and thank you for joining us for another episode of the Louisiana Public Health Institute's Health Table Talk series. I'm Shelina Davis, your host and the CEO of the Louisiana Public Health Institute. I pray that you and your family are safe and well, and that you're finding ways to help support one another as we navigate through the impacts of the COVID-19 pandemic across our communities. The Louisiana Public Health Institute is a statewide, community-focused nonprofit organization committed to ensuring that all Louisianans have fair and just opportunities to be healthy and well. We do this by a number of ways: through authentic partner and community engagement, using data and evaluation for action, through policy and advocacy efforts, through designing and implementing programs, and offering fiscal and administrative support to community-based organizations. We're headquartered in New Orleans and have staff in all regions across the state of Louisiana. Our staff work on everything that touches public health, from helping communities and individuals quit smoking, to reproductive health, to addressing the whole needs of individuals and families throughout our communities. Over the past few weeks, we've seen an increase in COVID-19 throughout the entire United States. There are now more than 3 million cases of COVID-19 in the US, which accounts for about 25% of all cases worldwide. Here at home in Louisiana, COVID-19 cases have continued to rise as well, with nearly 80,000 COVID-19 cases statewide. At the time of recording of this episode, Louisiana now ranks third in the US for the most new cases per capita on a rolling 7-day average. What does all of this mean? How does Louisiana's ranking among other states impact me personally? How does it impact our economy and our overall way of life? Today, we're going to talk about COVID-19 data trends and how we can all make sense of it. One of the reasons data around COVID-19 is so important is because we are learning new things each and every day. Through data collection, we can see where the virus is spreading, how fast, and how to determine the most effective methods and interventions, and so much more. We've discussed during other Health Table Talk episodes that public health is so much more than simply physical health or healthcare services. Public health is everything. It includes the economy, education, housing, transportation, and much, much more. And it includes things that have a direct impact on our overall health. And understanding the data is key to understanding this concept of public health. In fact, the COVID-19 pandemic is impacting the daily way of life for all of us in a way that has not been seen in at least a generation. Looking at the current COVID-19 data trends can help our state and community leaders, as well as our decision makers, take additional actions to further protect our communities. A prime example of this type of action is the governor's statewide face covering or mask mandate. To help us understand the data trends, I'm excited to have with us as our guest today, Lamar Gardere, the Executive Director of the Data Center. Lamar is responsible for guiding the data center's mission of transforming data into realistic action, ensuring quality standards, and the ongoing impact of the organization. He's also responsible for leading the data center's ongoing efforts to change local culture to one that embraces data as an intrinsic component of sound decision-making. Thank you, Lamar, for joining us today. How are you doing?
I'm doing very well, Shelina. Thank you for inviting me and thinking of the data center to contribute to this conversation.
You're welcome. So, Lamar, we know that data is can be hard to understand and sometimes confusing. I always think about my grandmother, who's 90 years old, and I think about how can I explain, public health and data in a way that she can understand, because she doesn't have a public health or data background. So I'm really excited to hear from you about how we can better understand our COVID-19 data that's been coming out and what it means for us as individuals within communities. First, let's talk about what we know about our current number of cases and number of deaths in our region and across our state. What are these numbers telling us?
Yeah, well, thanks for that question. And you're right. You know, when you think about data, it's always something that folks are somewhat intimidated by in some cases, right? You know, what does this mean? Do I understand what I'm looking at? Am I reading it correctly? And things like that. And so we do try very hard to make the data that we have available easily accessible to people and understandable. So, with that, let me try to talk through a little bit of the COVID data around cases and recent deaths. Let me see if I can just share my screen here. So what you're looking at right now is a rolling average, which means 5 days together being averaged together to get a a value for that day. And what we see is that New Orleans has a target threshold of 50 cases a day. In other words, as long as we're under 50 cases a day, we think that as a city, we're in a manageable position where we can continue moving forward with activities like reopening the economy, or maybe, getting together in small gatherings and things like that. And for 2 months, for over 2 months, New Orleans was very good in that regard, being under that 50 new case per day threshold. But as you can see, towards the right side here, over in this area, you see that our cases in July started to increase, and we finally increased enough such that we were over that 50 case per day threshold, now up into the 90 new cases a day or so. And that's a far cry from the 500 cases that we saw early on, but certainly the data is trending in the wrong direction right now in terms of new cases. You may recall also in the beginning that we're having a hard time with consistent testing, right? Everybody getting access to tests. So even though these numbers were coming out, it wasn't really clear if we really understood the full extent of the COVID-19 cases. But now we do have adequate testing in New Orleans, such that we think we've sampled the population enough to know that we're getting a reasonable number of folks tested. So we know about what the case rate is now, and you can see that we're up about 1,500 or so cases per day. And the thing that we're trying to average is 500 cases per day, right? And so we're doing really well in that regard. The goal here is to try to test 4 to 5% of the population per month, and so we're doing really well in that regard, which means that we sort of understand the caseload that is developing here in New Orleans. When you look a little closer at our metro area, this is a metro area view. Each one of the lines here represents one of our parishes in the metro area. The thicker blue one here is New Orleans. The dashed line is the New Orleans metro altogether. And what you see is that after a few months of pretty steady cases, not growing too much, it's now the case that the entire metro area is increasing in cases. Every parish is increasing. We're being led by Jefferson Parish and St. Tammany Parish here in terms of number of new cases per 100,000. We have New Orleans down here growing a little slowly, but a little more slowly than the others. But nevertheless, all parishes are trending upward in terms of new cases, which is just not the news that we were all hoping for by summer, right? So kind of heading in the wrong direction there. But we are not alone either in Louisiana or across the country. This is what's happening across the country. This orange line here is Louisiana. You can see our early spike along with some of these other states early on. Louisiana, the New Orleans area in particular, was one of the early hotspots, right? And then we see a significant and impressive drop off actually for Louisiana and for New Orleans, down to a pretty low case rate. Unfortunately, we see in late June and July that case rate starting to increase significantly for Louisiana, as well as for some other states who really hadn't seen high case rates before, like Arizona here, you see, was very low for a long time and recently increasing. Florida here, same thing, low for a long time and recently increasing. Texas and some others. And while you've heard Florida and Arizona likely in the headlines pretty often recently, Louisiana is actually right behind these two states in terms of growth per 100,000 residents, which is unfortunate. This time it is not centered in the metro area. This growth is happening across Louisiana. One last slide here. Though cases are increasing, in the metro area, we are seeing that that deaths per 100,000 is pretty steady. Like we're averaging across the metro less than a death every 3 days, right? So about every 4 days, somebody's dying on average across the metro area. You can see some of the smaller parishes here kind of jumping around a bit. You know, when they get one death, they might make their case their rate go up, and then it fluctuates because the parishes are smaller. So you can see that we're pretty, we're holding pretty steady in terms of deaths. Unfortunately, we do know that deaths do tend to lag behind cases. So as we see, unfortunately, cases starting to rise pretty significantly, we may want to be careful there that there may be an uptick in deaths on the way soon. So, we should all be very vigilant and be careful about that.
Awesome. Thank you so much. And, while you're talking about death rates, since the beginning, we've been hearing comparisons between COVID-19 and influenza. Can you talk about how deadly COVID-19 is compared to influenza or other causes of death?
Yeah, so absolutely. So in the very beginning, we did hear a lot of people comparing COVID-19 to influenza and some of the other common forms of death. And so we put some numbers together to help understand how COVID-19 stacks up against these common forms of death. And so this curve here is only for the first 4 months in which we've been experiencing COVID-19 deaths from March to now. And you can see that in those 4 months, we've had about 540 or so deaths, and it's far surpassed most of the common causes of death in New Orleans. And the interesting thing is that these numbers for the common causes of death are for an entire year, right? Whereas the COVID numbers are just for 4 months. And you can see influenza here at the bottom, 43 deaths typically in New Orleans for an entire year. These are 2018 numbers. So for the entire year, we would have seen 43 deaths from influenza. And again, in only 4 months, we've seen 540 deaths from COVID-19. So we see a pretty significant, an order of magnitude difference in terms of how deadly COVID-19 has been in our community. It's well above suicides and kidney disease and unintentional injuries, car accidents and things like that are factored in the unintentional injuries and accidents category. Often people are concerned about the homicide rate. Homicide in 2018 was at 146 deaths. COVID-19 is far and away a greater threat than that is. And so we are, in fact, coming up to the two most common causes of death in our region, which is cancer and heart disease. If we stay on the current trajectory of less than a death a day, we for the year won't surpass those thresholds. However, if the caseload continues to increase and we do see an increase in deaths again, COVID-19 is likely to become the most common cause of death in our region for the 12-month period.
I mean, if people aren't convinced by this, I'm not sure what will convince folks. But I mean, yeah. And so I did want to kind of shift a bit to talk about disparities. And early on, there was a great deal of misperceptions around Black people being immune to COVID-19. And we know that this is just not true. Can you talk about what we've seen in terms of race and ethnicity related to COVID-19 and any other important indicators or factors that we need to be looking at to better understand COVID-19 and risk?
Yeah, absolutely. So I'll jump back to the slides here to talk about this. Early on, it was discovered about early April, that about 70% of the deaths, the COVID-19 deaths statewide were to Black folks, about 28% to white. And then the conversation was, oh, well, there's a higher rate of underlying conditions for Black people than white, and that's the reason why more Black people are dying. The fact of the matter is that because Louisiana is only 32% Black, 58% white, and in fact, the most vulnerable populations, folks over 65, is only 25% Black, 70% white. That difference in terms of deaths from COVID-19 was in no way explained, given the population, by underlying conditions. In fact, the reality is that Black and white behavior in terms of these health conditions are actually very similar in New Orleans. Diabetes, Black people are, dying at a higher rate, with diabetes of 17.7% to about 12.8 for white. But again, that's only a 5 percentage point gap, right? Not nearly enough to explain the 42 percentage point gap early on that we saw. Similarly, high blood pressure is higher for Black than white, obesity higher for Black than white, but those differences not so much at all to explain, again, the deaths. In fact, for heart disease, which is one of the most common comorbidities with COVID-19, white Louisianans have a higher rate of having that as a comorbidity for death than Black students. So again, the rate of underlying conditions doesn't come near at all to explaining what's happening here. Since we learned this in April, I think the conversation about the danger to African Americans has shifted considerably. Early on, there were some thoughts that Black folks weren't susceptible to COVID-19. I'm not sure where that idea came from, but it was quickly dispelled as myth, and people, I think, became a little more vigilant. And since then, we've seen Black deaths decrease about 17 percentage points, and actually, unfortunately, white deaths have increased 18 percentage points since then. And so we see the demographics starting to shift and coming into a little more balance with the state's own demographics. For the week of July 6th, in fact, we saw 52% of people who had died from COVID-19 so far in Louisiana were Black, 46% were white. And we also know that Hispanics are being significantly impacted, but the data doesn't show Hispanics very, very well. It's an artifact of the data. It's not high quality enough for us to know what's happening with the Hispanic community, though we know that there's significant risk there. It's so far only showing 2% of deaths as Hispanic. However, we believe that that's likely an undercount. We did get some data from the coroner in New Orleans recently that has helped us to understand these death rates a little more in New Orleans, which helps to provide a little more of an understanding of like what's really happening with these COVID-19 deaths and race. And what we saw was very interesting, that when you look at the deaths in New Orleans, and these are deaths from March 22nd, when we had our first COVID-19 death in New Orleans, to June 5th. We'll update that as we get more and more data from the coroner, but that's what we have right now. That there was a significant difference between populations that were in long-term care facilities versus just the general public. In fact, when you look at cases overall, you see that 76% of African American of COVID deaths in New Orleans were African American. About 20% were white. But if you look at just the portion of the population that was in a long-term care facility, there was actually a higher percentage of white deaths than Black deaths, right? Which shows you that really with this virus is not doesn't care so much about your race. The virus does care about its opportunity to for you to be exposed to it, right? So in those long-term care facilities, exposure is about equal, right? You remove the variable of people having to go to work. You remove the variable of differential density in houses and who lives in the houses together and the kinds of care that people are able to get, whether or not you could practice social distancing or remote work for your jobs. Once you remove all those variables, you see that the rate of death ends up pretty balanced, just based on who's coming into contact with the virus. So along that same vein, right, when you remove the long-term care facility deaths from the calculation, what you learn is that in New Orleans, the racial disparity is even greater than we thought, right? So when you remove that population, 88% of the deaths, COVID-19 deaths in New Orleans, were to African Americans. About 9% were to white. And what that leads to is this conversation about, okay, what are the circumstances that that many Black people in New Orleans are faced with, either around income or housing or the kinds of job they have or poverty levels. What might be the factors connecting to that? So, we dug a little deeper, as the data center tends to do, and we've got a little more data to help get to some of that stuff. This is a timeline of deaths for COVID-19 using that same coroner data, and we see that early on, Black people in facilities, sort of in long-term care facilities, the deaths started there a little bit later than they were for white people in facilities. But what we saw is that Black people who were not in long-term care facilities were being exposed early on a lot more, and so we saw deaths really spike pretty early for Black people who were not in long-term care facilities. So just in the general public, the general population, right? These other areas of white people not in facilities remain pretty flat the entire time, and even Black people in facilities remain pretty flat the entire time, right? And this is just through June 5th. So you see, this is not really taking into account recent increases in deaths due to rising numbers, but it is starting to show how the wave of COVID-19 deaths were happening. Again, going a little farther in, you're starting to see that these deaths are tied to exposure and income and things like that. We know that median income in New Orleans has had a significant disparity by race for quite some time. Black income being about $24,000 a year, a household income about $24,000 per year, white income being about $70,000 per year in New Orleans. Similarly, 32% of Black New Orleans households are suffering with poverty, whereas it's only about 10% for white households. And so we see that economically, in terms of job loss and the circumstances that you're in, Black folks are in a more difficult position to weather the pandemic, as it were. And these are not new disparities, right, that are affecting us. This is these are graphs showing us a 40-year time span in New Orleans, where we can see, back in 1979, there was a significant disparity between Black and white in New Orleans, and that gap has only grown over the 40 years since then, right? And you can see similar gaps for poverty between Black and white and Hispanic in New Orleans. And so these vulnerabilities and inequities have been in place for a very long time. What you're seeing with COVID-19 is the accumulation, the accumulated, I guess, manifestation of these inequities, resulting in vulnerability that's leading to death due to the pandemic. Again, a little more color on it. When you look at the essential workers, these are people who were working throughout the entire pandemic and were being exposed on a regular basis through their work. You see that some of the lower earning essential worker groups, right? So these are like retail folks. These are people like cashiers and grocery stores and things like that. People who are on the front lines tended to be overrepresented by people of color. And in fact, the essential worker population in general was overrepresented, or is overrepresented, whether you're a man or a woman, by people of color, if you're looking at folks who are earning less than $30,000 a year, right? So in other words, to put that a little more plainly, Black people overrepresent the numbers of essential workers who are earning less than $30,000 a year, right? Which means that their level of income to take appropriate measures is not as significant as some other populations. What that also suggests is that your ability to make decisions about whether or not you are going to go into work versus stay home because you don't feel safe, or your ability to work remotely versus having to go into that job is not the same, right? If your lower income turned out that you often didn't have the kind of job that allowed you to work from home and avoid exposure early on. often, it's also the case that 71% of New Orleanians, of Black New Orleanians, experience liquid asset poverty compared to only 29% for whites. Similarly, 33% of Black households in New Orleans are zero net worth households versus 16% for white. And what these two things suggest is that you didn't have a choice about whether or not you went to work, whether you felt safe or not. You had to go in to work. Your survival depended on it, which put you on the front lines, put you in risk of exposure more so than others who had more options available to them early on. And what's exacerbating this is that housing conditions for Black and white tend to differ, right? We know that for people who are 60 or over, there's nearly 4 times the greater rate that, if you are Black, you'll be living in a multi-generational household versus white, right? 12.2% to 3.8%. What that means is that, you are in a house as an older person, over 65 or so, more vulnerable. You're in a house potentially with a younger person who's maybe in their 30s or so, and maybe a grandchild in that house as well. It's multi-generational, which means that that older person is subject to the exposure that the kid brings home, right? Or that parent who perhaps themselves is an essential worker, right? Having to go out to the job, be exposed to virus risks out there, and then bringing it home, right? And that exposure being transferred to the older folks in the house, right? And so that's happening at a much greater rate for Black than whites. We also know that if you happen to be lower income, then there's also a greater chance that you have greater density in your house. In other words, you have more people in your house, right? You may in fact have more people than you have places to quarantine someone. So if you replay this scenario, now you're having to go to work because you don't have the resources to not go to work. You don't have the kind of job that affords remote work. You are in a house that you're more likely to be in a house that has someone who is older in that house, multi-generational house, and you don't have the space within that house to self-quarantine, if you know that you've been exposed or believe you've been exposed. What that suggests is that the greater exposure that Black people are experiencing in the public is being brought home to the household and exposing those in the household, whether you have an underlying condition or you're an older person, to that risk that the younger, perhaps healthier person is picking up out in public. It's being brought home to them in a way that's different for white households in New Orleans. Similarly, it is the case that early on, the only way to get a test was through drive-up testing. Yet in New Orleans, 27% of households did not have access to a vehicle. So, I'm sorry, 19% in the most recent stat did not have access to vehicles. And that was significantly higher than other parishes like Jefferson or St. Tammany, which tend to have fewer numbers of people of color, significantly higher than the metro area overall, significantly higher than the US overall. And so there was a decreased ability early on for particularly people of color in New Orleans to be tested and know whether or not they were COVID positive, and then take measures that might, protect their loved ones from being exposed based on their own exposure to COVID-19. And so put all those things together, and those things do help to explain the gap between Black and white in COVID-19 deaths.
Thank you. Well done, Lamar. And so lastly, in the next couple of minutes that we have here, what words or messages would you like to share with our viewers about COVID-19?
Yeah, well, I think that there are a few things that we understand now. I think with a little more light than we did before. One, that there is significant risk in the inequities that develop in our society, right? These are not concepts to just kind of be discussed and things like that. They have real consequences for folks as they're being manifested now. And studies across the country are starting to show that the reality of how interconnected we actually are in our environments. And what it's showing is that even those counties, parishes, cities across the country who have elevated rates of African American deaths, right? That phenomenon is not one that is unique to New Orleans. That is the case across the country. But where we see higher numbers of African American deaths, we also see higher numbers of white deaths, right? And so, regardless of whether or not one community appears to be affected more than the other, we are very interconnected. And so, what is happening to one will spill over and affect the other. And that is being very starkly shown to us through the COVID-19 disaster. But that concept in terms of equity is true across the board, right? That the things that negatively impact one portion of the population holds back or affects the larger population's ability to do different things. So it's in our best interest to make sure everybody is healthy, everybody's safe, and everybody's able to perform well. The other thing that I'll leave you with is the importance of data. Really, the importance of good data disaggregated by race and gender and a bunch of other ways. If we had more data, we could provide, more detail on, jobs that put you more at risk, or the situations or circumstances that put people more at risk, so that interventions could be developed, right, that make us all safer, right? But there isn't that data always available to do that, right? And so it really, drives home the idea that it's very important to collect good, robust data and have it be available, whether you're in times of pandemic or not, and just have that data always available. And we really can't be afraid to ask people certain questions to gather that data, right? Sometimes there's reticence to ask people about race, to identify their race and things like that, which is interesting since race is a thing that's so readily apparent just by looking at someone, but the taboos around it suggest that maybe it's impolite to ask people to identify their race when taking certain kinds of tests or doing certain types of things, or in some cases there's legitimate reticence to answer that question because race has been used in different ways negatively over the years. But we have to learn that it's more important than the taboos associated to gather that kind of information, so that we understand what's happening with different groups of people, and so that again we can build interventions which help to keep all of us safe. And so those are the things that I would leave folks with. We're still in the throes of this situation, so we should all continue to be careful as we see that our mixing in public is causing case rates to go up again, right? And so continue to practice social distancing. All the medical professionals would now suggest that wearing a mask in public is very important. And again, what affects one group is ultimately going to affect another. We're kind of all in this together, and so we have to all be careful together. Whether you're a younger person or an older, for an older person, it's important for us to all realize the collective risk that we're either subjecting ourselves to or avoiding, right, through the right kind of behavior.
Thank you. Thank you so much, Lamar. I think it's a great reminder that we are all in this together. And I do appreciate you for spending time with us today and sharing a bit and breaking down data a bit more so that we can understand it a bit more. So thank you so much for being with us.
My pleasure, Shelina. Thank you so much for the invitation.
Thank you for joining us for this edition of Health Table Talk. I hope that you learned something new and are able to use this information to guide how you make decisions for yourself, your family, and your community. We know that COVID-19 is not over. We need to mask up, physically distance, and wash our hands. Remember, as Lamar shared earlier, we're all in this together. We're all interconnected. And until next time, please stay safe and stay well.